Hello, I'm Dr. Rosemary Guerguerian with NBC News. I'm an ER doctor with 20 years of experience, and now I'm working with NBC News, and I'm here to answer your questions about the coronavirus. So if you have any questions, go ahead and ask them in the comments, and I will try to get to as many as I can. While we're waiting for some questions, I thought I'd tell you a little bit about the news today. So a small study came out of China examining the effect of climate on the spread of the coronavirus. And what they found is that regions that had warmer climates that were more humid had slower spread of the coronavirus. They used that information to try to model out what might happen during the summer. And so they're predicting that perhaps the spread of the coronavirus will slow down during the summer. Now, we can't really use those models to say for sure that that's what's going to happen. There's a whole lot of other real-life factors and events that might play into that, but there did seem to be some correlation that hotter, more humid climates had slower spread of the virus. Other news that came out, Cuomo in New York announced that New York will be the first state to use convalescent plasma to treat patients with the coronavirus. What convalescent plasma is basically taken from patients who have already had the virus and recovered. And those patients have built up antibodies, which are the proteins in the body that help fight the virus. Those antibodies usually take over a week to develop when the body is learning about a new virus. In this situation, they would take the plasma of recovered patients and then infuse it into sick patients now to help their bodies also fight the virus. They're going to reserve that to the really critical patients for the moment, because there are some risks with doing that, giving the wrong blood type or possibly introducing a new blood-borne infection. So it is risky, but this is something that could help the patients who are currently ill. This is a very old kind of treatment. This predates vaccines, but I think it's worth a shot, and it sounds like they're going to be starting that in New York. They're going to be the first state to do it. And now I'm going to go to some questions. Do we have any questions?
So one of the questions asked right now is whether or not using PPE such as gloves is good for handling money or any sort of other things. Okay,
well, so PPE, in terms of gloves, that can be sort of a double-edged sword, because if you're wearing gloves, it could give you a false sense of security. The main point is that the coronavirus is spread by droplets, and droplets either they come out when you're coughing or sneezing, and they get on surfaces, or they get directly on you. And the whole idea is when you touch those surfaces with your hand and then take those droplets to your face, they can enter through your nose and mouth. Now, wearing gloves is really no different than the skin on your hands, because if you have the gloves on and you have a false sense of security, you may still touch your face and your nose and mouth with those gloves on, and it's not really going to do you any benefit. Your skin is actually an excellent barrier against infection. The virus is not going to seep in through your skin. It has to get through the vulnerable areas, which are your eyes, nose, your mouth, where you have mucosa. So more important than gloves is to wash your hands frequently, be careful of touching surfaces, don't touch your face. In and around the house, disinfect surfaces that are frequently touched, like doorknobs and keyboards, phones, and things like that.
So Zach is asking, he drives a truck over the road. Should he avoid family contact when he's home?
What do you mean by over the road?
So he drives over the road. He's a trucker over the road.
Oh, I see what you're saying. Okay.
When he gets home?
Okay. Well, the thing is that we need to be practicing all of these things all of the time. So a trucker who might be going from state to state to state might be driving through regions that have higher levels of community spread. So there's always a chance that you may come into contact with the virus more than someone, say, who's living in a rural area that doesn't have the coronavirus yet. But nonetheless, the recommendations are still the same, which is social distancing, try to keep a distance. So those droplets I was talking about, the coughing and the sneezing, the risk to the people around you is at about a 6-foot radius. And so, or I should say 6-foot diameter, but keeping about 6 feet away from folks reduces the risk that some droplet will come as you're speaking or talking or whatever, and then infect the person that's near you. And then again, the hand washing and the surfaces, disinfecting surfaces, all of those things, even if you are at a slightly higher risk of bringing the virus home.
Okay, can you ask, or can you answer for us, can you differentiate this between the flu and other like colds and whatnot?
Yeah, so now it is a little bit difficult to differentiate the coronavirus from the cold and flu because a lot of the symptoms are similar, but we are seeing a slightly different pattern with the coronavirus. So if you think about the flu usually hits right off the bat with fevers and body aches and chills. Usually patients will say that they feel like they've been hit by a truck, they don't want to get out of bed, they just feel awful from the get-go. With the coronavirus, we're seeing that there's sort of a slower build. And so a lot of times people are complaining of having vague symptoms. So like headache, maybe a little sore throat or a little bit of a body ache, and waxing and waning fevers that come and go over a 3 to 4 day period before any of the other symptoms show up. And then the symptoms of coronavirus are primarily cough and fever. So almost 90% of people with coronavirus had fever, and a high proportion of those people also had cough. The cough is a dry cough. Complaints such as like runny nose and congestion we are not hearing as commonly. Not impossible, but they're just not as common. And then if you want to try to distinguish it from a cold, the typical presentation for a cold is usually cold starts with a sore throat. It does that for a day or two, and then it moves up into the face and the sinuses, and people tend to get really congested. And usually the third and fourth day of the cold is the worst with that congestion. And then it kind of moves down, and you develop that lingering cough that may go on for a few days or even a week. With the cold, people don't tend to have as high fevers and that waxing and waning presentation. So that's kind of the trend that we've been seeing with the coronavirus so far.
Okay, can you differentiate for the viewers whether or not the difference between mild, moderate, and severe illness?
Okay, so the question is what's the difference between mild, moderate, and severe illness? And so severe illness, I'm going to start with that one. Severe illness is when you're having difficulty breathing, when you're having shortness of breath, if you're feeling winded, like for example, if you're climbing stairs and you get winded and you normally wouldn't, or even worse, if you're just sitting on the couch and you're just winded and you can't catch your breath, that would be a sign that this is a severe illness and you need to seek medical attention. Even if you're having wheezing that's severe and it's making hard for you to breathe, those would all be reasons to seek medical attention. In that case, we do recommend that you go to the ER, but give them a heads up. Have either yourself or a loved one call them first, let them know you're coming so that they can be prepared for you. Mild to moderate illness is going to be more of just, it's annoying and it's frustrating and you hate the way you feel, but you're doing okay. So you may be coughing a lot, you might have some mild wheezing, feel achy, not feel so great, but you're surviving just fine. And in that scenario, we are asking people to stay at home. So give your doctor a call or call a telemedicine service, let them know what's going on. They may or may not be able to arrange testing for you, but in that scenario, we want you to stay home and take care of yourself at home. We're also asking that you isolate yourself, so self-isolate, and the way that you can do that is pick a room in your house that becomes your home base and treat that room like it's a hospital room, meaning that's where you sleep, that's where you eat, that's where you watch TV. If possible, if you have your own bathroom, that would be the best. Stay, a distance from anyone else in the family. Don't have people coming in and out of that room. If you share the bathroom, disinfect the bathroom, all of the surfaces every single time you use it. Don't forget the handle on the toilet, and don't forget the knobs on the faucets. And if you have to be near your family members, if you have a face mask, wear the face mask. Certainly don't go out in public. Don't get people to bring people risk.
Okay, so another question that we had, Cynthia Ellis asked a little bit earlier, whether or not she can have a visitor. She's obviously self-quarantined. She was wanting to know if she could have a visitor come over. She was trying to physically distance.
Again, I don't think that that's the best idea. If you would like to have a visitor, it'd be better just to have a chat online. But for the time being, while you're sick, I would have other folks stay away. If they need to deliver groceries, maybe they can leave it at the front door. So that's going to be the last of our questions today. And we are learning more and more about this virus every day. So stay tuned on all of NBC's platforms for the latest news on this pandemic.